From the Bare Knuckle Studios in Dallas, Texas, welcome to The Mike and Brian Show. And now, here are your hosts, Mike Coffin and Brian Lee.
2, 1. Hey, everybody. How's it going? Welcome to another episode of The Mike and Brian Show. What is this now? Number 12?
12,
Number 12
nice.
of The Mike and
Lucky
Brian
12.
Show.
Lucky 12.
We happen to be at, if you guys can tell, the background has changed substantially today. We're at the Regevity Stem Cell Institute, and we're very honored to have the Dr. Douglas Wan here with us. He's the Chief Medical Director, is that right?
Yes.
And then we have Bernie Diamond here, who's the co-founder of Regevity.
Yes. How's it going?
Well, thank you very much, guys.
Thanks
It's
for
really
being
good to
with
have
us.
you.
Yeah,
Thanks for
having
having
us.
us.
It's nice to actually have some experts with us. It's not just us talking.
Smart guys.
Yeah, that's right.
Other than us, right? So we try to not be on the camera as much. So, one of the things that we want to talk about, right? So you guys are about stem cell treatments. And we hear about this stuff all over the place. And I'm like super interested in the stem cell treatment, especially after the surgery I had on my arm and what it does. So I think the first question I wanted to get to is what type of treatments can stem cells help? Like, what are you working on right now?
So the conditions that the stem cell therapy or regenerative medicine treats are, what we focus on is mostly orthopedics. So such as, somebody with the shoulder pain from shoulder arthritis. They may have rotator cuff tendonitis or rotator cuff tear. They may have labral tear. Or somebody who may have hip arthritis, or they may also have labral tear in their hip, knee arthritis, which is one of the most common things that we treat. And then they may also have meniscal tear, ACL tear, or PCL tear. And then also back pain. So back or neck pain. It could be from degenerated disc, it could be herniated disc, bulging disc, facet arthropathy, or ligamentum that's enlarged, and then that's impinging against the nerve. Or some people may have some spondylolisthesis, things like that. And so we provide the comprehensive care from the least invasive and then all the way till the minimally invasive procedures.
Yeah.
Right.
The whole idea behind it was, there's always been the Band-Aid solution of cortisone and steroid type of injections. And then there's either the patients living on NSAIDs or anti-inflammatories and then surgery. And so we wanted to come up with a solution, a true solution for patients that is non-invasive. We want to avoid surgery. We want to put him out of business from surgery. But
Trying to put myself out of surgical business.
So, and arthritis?
Yes.
You said, right? Arthritis,
time.
right?
Yep.
So what is like an ideal patient? They come into you, they've already had some surgery before, they have an injury. At what point do we start looking into stem cell treatments as a patient?
Sure. As a clinic, we provide comprehensive care, so we also do physical therapy, and we do other conservative treatments such as cortisone injection or hyaluronic injection. But the most ideal type of patient for stem cell therapy is somebody who's had arthritis, or they may have had some ligament tear or tendon tear. They had some conservative treatment already. It could be some cortisone injections, some physical therapies, and those type of treatments. But it failed, and they're continuing to have pain. But then now the next option is surgical treatment. So there's a huge gap, right? So somebody had treatment with just simple injections with cortisone or local injections, and then now they're being told that they need to cut their bones off and then replace it with metal and plastic, and then completely change their lifestyle, right? They can't really participate in pretty significant level of activities because once you have total joint replacement, your life is very limited. Your activities levels are limited.
Right.
But there are a lot of people who are much younger these days who are being told that they need total knee replacement, total hip replacement, shoulder replacement. But there's got to be something between. Just like in the past, even with spine surgery, I do minimally invasive spine surgery. So after injection, it was a maximally invasive surgery, big open back surgery that stripped the muscle off the back. And I thought, there's got to be something between. So at the time, it was minimally invasive. So I developed a lot of the tools and equipment so that we can perform, just like doing knee arthroscopy, we can do it with the spine as well. But then, even then, that's still a big jump. So there's got to be something that's between cortisone injections and then surgical treatment.
Right. So stem cells. So maybe for people that don't understand, maybe we could kind of dive a little bit into what stem cells are, what they treat, how they work. So one of the questions, that always comes up in my mind, I see a stem cell and I picture it like attaching to your bone and it becomes a bone.
That's what
I
I
don't
was
know if that's true or not, right?
That's what I was imagining when I was hearing this. Story. I'm like, it just grows your knee back.
Why
That's
doesn't
cool.
it grow a nose on my knee? I mean, I don't know, right? And is it the secretions? Is it the what? How does it know what to do?
What's the mechanism?
This is an extremely exciting field because I think maybe 10, 20 years from now, there will be no surgery.
Yeah.
Majority of the ailment and condition can be treated with cell therapy, and which is a stem cell therapy, right? And so the way it works is when there's several different kinds of stem cells. There's embryonic, which is considered pluripotent, which can become just about anything. So if we don't harvest anything from embryos, and so there's no ethical issue whatsoever, right? Because we harvest specifically adult stem cells. So, but the embryonic stem cell has the ability to become just about anything. Also, they're not really good for treatment anyhow, because since they have the ability to become just about anything, it can become cancerous in your body. And so versus the adult stem cell is more considered multipotent. So they've already divided to certain type of cells already. Gotcha. And so we want, especially for orthopedics, we want the type of cells that has the ability to develop into cartilage, bone, ligament, tendon, and fat. That is the lineage that we want.
Gotcha.
Okay? And so that's the adult stem cell has the ability to do so. And stem cell is a type of cell that has the ability to, once it receives certain type of signal, change so that it has the ability to become fat tissues or cartilage, bone, ligament, and tendon. That's the type of cell we want. And then once we harvest it, then we actually place it in the injured area. Then there's several different things that goes on, right? So one itself has differentiated to the type of cell that can actually repair the injured site. But also it sends out a signal. It's called paracrine effect, and sends out a signal to the local stem cells also. And then basically change those cells, and so that they can start to repair itself as well.
Yeah, it's really, if you think about that, it's just impressive hearing that, right? And right now, what ends up happening is patients, again, there was cortisone and then there's surgery. And patients, they become very reactive to it, right? They wait till they feel like they can walk off the knee injury or the hip injury or whatever, and they become reactive to the whole deal. And so when someone comes in for stem cell therapy, it's been frustrating a little bit to see these pop-up clinics going around, and they're just injecting in little patient rooms. And for those who can see, I mean, there is definitely a technique and there's the right equipment that has to be utilized to have it done the right way. And then when we take the mesenchymal cells, the MSC cells, when it's done the right way, we do everything under ultrasound. So we do it to where we are guided to the exact area of injury. And when we're injecting those mesenchymal cells in there, the MSC cells, we're signaling them, and then they're regenerating into cartilage. Just like you were saying earlier, that's very accurate. They can turn to any type of bone, ligaments, tendons, muscles. And so there's a right way to do it. And so that's what we focus on. And what's challenging and frustrating for me and for Dr. Juan, for Aaron, our other partner, is that when patients get to the point where they're really forced to have to look at some sort of solution, surgery or stem cells, people are targeting these patients in a desperate mode. And that's why we formed Regevity, is because we really wanted patients to have a real solution. And we do a little more than just stem cells. We have 4 pillars to the way we do things. We do it through nutrition, through supplementation. We also do it through therapy. And so there's such a unique way to do it that we separate ourselves from anybody else out there. But
no, that's great.
You were talking about MSE cells, right? And orthopedics. So do you collect them from one place? Is it just one spot you get them from?
I was actually going to ask about that too, like kind of leading off of that question also. So much of the research that, even I've done, just Googling, because everything's right on the internet.
Everything's on the internet. It's on the internet. It must be right.
Yeah. So like most of the stuff that I've read is that they take stem cells from your fat. They separate it from your fat, right? And then re-inject it back into whatever through an IV or something like that. So how is like MSC cells or based off what I read from the procedure that y'all do, it'd be harvesting it from your bone marrow.
Yeah.
Right. So how is that different?
I'll let you answer this one, but I'll just say this part. When people think about the adipose fat, immediately people everyone starts thinking of like a little mini tummy tuck because they're taking the fat.
sure.
How much can I get out of here?
And it's not that way at all. But I'll let Dr. Juan answer this.
So there's several different ways of actually obtaining the MSCs, mesenchymal stem cells, right? So you mentioned the fat adipose tissue derived versus a bone marrow driven stem cells. So adipose, technically, it's not allowed. So
Illegal.
The true method of performing adipose tissue derived stem cell is illegal in the United States. The reason for it is because you have to actually manipulate it. So all the people who are doing the adipose tissue is cheating, cutting down so that it actually bypasses the FDA's radar, right? And so the true method is once you harvest it, so you do a mini liposuction with the syringe. So it's not like a real liposuction. And then if you also use the ultrasound to free up the adipose tissues, like the traditional type of the liposuction, it destroys the cells. So there's a specific way you have to harvest them. Once you harvest them, then you have to go through some chemical process to isolate the cells. You have to culture them and grow them. That's portion where it becomes illegal. The only thing that you can really do based on the FDA is you can just add saline solution. But that's not how to do it. And then once they grow it, then they re-isolate it and then inject it back. Then at the same time, then the way it really works is that it works about the same as the bone marrow aspirate. But way the most of the clinics are doing it is they get the adipose tissue, they agitate it, they get a little kit where they agitate it, hoping that the cells would actually come out of the fatty tissues. And it doesn't. It may or may not. And so theoretically, adipose-derived stem cell will really work. However, way it's allowed people to utilize them in the U.S., it just doesn't work.
Yep.
So it's just not an efficient method.
It's just not an efficient method. And so the only way that's really allowed by law in the United States is bone marrow driven. And also another thing to consider is and then the bone marrow, we harvest it typically from the ilium, your pelvic bone. And even within the pelvic bone, we harvest it from the back portion, posterior aspect of the ilium, because that's where it's really thick. And then that's where most of the bone marrow is sitting. And then there's a special techniques that we utilize. We increases the harvesting by over 300%.
Yeah.
Okay.
Wow. And so all the procedures done, patients under local anesthetic, so they don't go to sleep for it.
Yep.
And then under the visualization of intraoperative floor scan, we know exactly the spot where we need to go, and we put a fairly thick needle inside the bone, and then we harvest them with our technique.
Gotcha.
Okay.
So for no matter if I've got like a spinal issue or if I have a joint issue or anything, they're always going to come from that one spot. Is that right?
That's correct.
And what's the recovery time from that extraction? I don't know if it's is it difficult. You have to drill in there. I'm not really sure.
Yeah. So the recovery, it's a same day procedure, and the only thing that's really allowed is a same day. And there's got to be a minimum manipulation. So once we harvest them, the needle itself is thick, but it's still needle. And then we make a very small incision, but there's no stitch because the incision is so small. So once we harvest them, and then with our technique, and I think I mentioned that it increases the harvesting by 300%, the special technique we utilize. And then after that, then we isolate the stem cells. And then we put them through a specific type of filter, and then we concentrate them. And so there's a huge difference. There's some products that's out there that says, well, you don't need to concentrate it. But we've been clearly documented that there's a significant difference between the concentration and non-concentration. Because there's only so much of the CCs that you can place inside the disc.
Right.
Or
there's only so much space in there, right?
There's
Because you're
just not
literally
enough
putting
space.
it. You're literally
Yeah.
injecting it in there, right?
Yeah, so there's really not that much space. So you want to have maximum amount. You want to concentrate the cells as much as possible.
Right.
So you definitely have to concentrate them.
Gotcha.
And then the patient, as far as the recovery is concerned, what you want to do is you're inducing a little bit of inflammation. So first 2 weeks, we ask patients not to take any anti-inflammatories like Aleve, ibuprofens, and things like that. And then first 2 weeks, it's going to flare up. So they may have some discomfort. And then after that, between 2 to 4 weeks, patients they start to feel better. By 6 weeks, they said, oh, my pain is gone. It's
gone.
And that's the majority of the time. Or my pain level has declined.
Right.
But, even just last Friday, our last patient with bilateral knee, he said, he was pretty sore by Sunday. And then Monday, he gave us a call. He said, he started walking around and, doing his errands. By late afternoon, he realized he didn't have any pain.
Wow.
That's awesome.
Wow.
Right.
Yeah, it's pretty. I mean, you got to think about it. When someone's come to the point also where they're doing stem cell, where they're going to come here, they're trying to avoid surgery. there's a day or so of some uncomfortableness from
not
the
a big
needle,
deal.
but
Yeah.
man, compared to what they're feeling
Right.
for their joints,
Well, I just kind of
that's
wonder,
awesome.
like, if you take somebody who, they've got a job or they got whatever, right? And if are they going to be out for a long time after the treatment, or
No.
what do they have to look, forward to? Kind of
So,
thing?
I ask if it's a light duty job, they can go back immediately the very
Yeah.
next day. If it's a heavy duty type of job, then we want to do some modification of their job so that they're not really straining the specific joint or back that we address.
I got you.
That's awesome. I really like the fact that that y'all take the approach of having it being minimally invasive, just because I've seen so many people out there that have received like whatever joint replacement surgery, or like people that had back problems, because I had back problems a few years back that I got rid of through exercise essentially. But when people do, like, they replace their bone, right, and the fact that you can't do what you normally did before because it's not you anymore.
Yeah,
right?
so
Right?
that's
I mean,
why
it's just-
surgery is a last resort.
Yeah.
This is coming
Yeah.
from a surgeon, right?
Right.
And I've been doing surgery for 14 years. And the reason I went into surgery is because my father had 4 back surgeries, and it failed. He had an infection, and his back, because he had a traditional open back surgery, especially back in 80s, that's the only option they had. His back feels like rock, and he doesn't have the full motion. I mean, he was a 6-degree black belt in Taekwondo, and he was a freaking fighting machine.
Damn.
And then he suffered from chronic pain for 30 years. And we didn't have insurance when we were growing up. And so alcohol was his, painkiller.
Yeah.
And so, I kind of want to forget about a certain phase of, my life, especially when we were growing up. But he did everything he could to support the family. I mean, he worked as a janitor, and even with his pain, but because, we're immigrants, so he had to put food on the table. We didn't have insurance, and we lost everything. I mean, the little that we had. And so, watching him going through that process, and I stayed with him in the hospital. I think I was 14 years old, and then taking care of him because it was at the Fort Worth County Hospital, and there was no nursing care whatsoever. And then I saw a pus just pouring out of his back when it was infected. And so when I got into spine, that's the reason why I went into spine, and realized we needed to change. Everything that I learned how to do was maximally invasive. For training, it was great because I got to see everything.
Right.
But then now, thanks to playing a lot of video games when I was young,
Finally paid off.
it finally paid off, right?
I don't want
hold
my
out
kids to
there,
hear that. I do not want my kids to hear that.
Just keep playing.
So
It'll be
yeah,
fine.
video games aren't all bad. It's fine.
So I could visualize things in 3D in my mind.
Yeah.
And so actually, they've actually done studies for robotic surgery and minimally invasive surgery. Kids who played, ball sports like tennis, basketball, and things like that improves hand-eye coordination.
Right.
And then also kids who played a lot of video games, it actually helps them with the surgical
yeah.
skills.
Wow.
And so, going back to it, but, watching my, father suffer like that, I knew that we needed to do something different.
Yeah.
And that's why I dedicated, developing a lot of
So
minimally
if
invasive
somebody's
techniques.
had like an injury like that years ago, I mean, it sounds like it might even be useful to some degree. I guess age of the patient probably matters, right? But it might be useful if somebody's had something like 10 years ago, I had a rotator cuff thing and it still kind of bothers me. Is that still a thing? Is it
Here's
still
the thing
possible?
to also realize, surgery is not guaranteed. Once
Yeah.
you cut,
cut.
because I've been in
Yeah.
orthopedics for 9 years. I worked specifically for one of the biggest trauma companies or orthopedic companies in the world. At the time, they were $13 to $14 billion. And so I specialized in foot and ankle surgery. So we did joint replacements, we did all sorts of fusions, whatnot. And, sometimes, a lot of it can be the patient, doing what they're supposed to do to make it come out, the outcome come well. And sometimes it could be for various reasons why it doesn't go right. But once you cut, just like Dr. Juan was saying, you're prone to infection. You're prone to being down. You're prone to, now you're looking at tons of rehab. You're looking at exponential costs. People think that, I pay my deductible and that's that. No, there's not. There's so much more to it. And so that's the whole thing that we're wanting to really, really try to avoid. So avoiding surgery is a major deal. This is a viable option. And what we do, whenever we have a patient come in, we do not tell every patient, hey, you need stem cell. Hey, you need stem cell. We evaluate you. Because sometimes, we had a patient that came in that, she was an RA patient, rheumatoid arthritic patient, and she didn't need stem cells. She just needed to adjust her diet. And we had her we gave her a diet that was high in green leafy vegetables, anti-inflammatory types of foods. And, and then the other side of it, we have patients that will say, look, you're not a candidate for stem cell therapy, unfortunately, because you waited way too long, you are
Yeah.
bone on bone, and you're going to have.
So there has to
surgery.
be something in between there,
Yeah.
right?
Yeah.
If you're talking about discs, for example, or something, it has to be something for it to latch onto and regrow.
Yeah, exactly. Also, if they already had surgery, certain areas, there's so much scar tissue, you just can't get the blood vessels to regrow to that area. So there is a limitation to stem cell. But even you had surgery, but then let's say for a spine, you had at 4 or 5, but the level above may be breaking down. Level 2, 3 may be breaking down. So you may have an opportunity to get treatment with stem cell therapy. But there's certain ones who have had back surgery. They may have had discectomy, for example, but it was a minimal surgery, and then the symptoms came back. So they may have an opportunity to get treated with stem cell therapy. But that's why you need a full evaluation. Just
Right.
because somebody's got a back pain, and then you can't just stick a needle in there and inject the stem cell hoping that it would work.
So like, for example, at the gym, we've got an instructor. He's had 2 ACLs replaced, Is that something he's still like, still not right, still hurts? Is that they could come in and get an evaluation maybe?
Yeah, absolutely.
Everybody.
Yeah.
I mean, everybody should come in for evaluation. If you're having that kind of discomfort, come in for the evaluation. You got nothing to lose by finding out what's going on. Right. I mean, we look at MRIs all the time. We look at we'll do consultations with certain patients on certain days. Well, not certain patients. We'll do consultations on certain days for free. We'll look at MRIs with patients, and Dr. Juan does the full evaluation. And the other cool thing about it is that Regevity, we have multiple specialties. So we don't have a hand guy looking at foot problems. We have our foot and ankle physicians looking at our foot and ankle patients. We have our spine physician looking at our spine patients. Right. And so we have our orthopedist, our general orthopedic who does sports medicine, focusing on knees, hips, and shoulders. And so that's really that's an important thing to really know going into it.
Now,
I was just gonna say it's funny that you had to explain it like that, just because you figure that if you go to a doctor's a doctor, but there are specialists that do handle these things, and it's good to know that the hand doctor's not looking at the foot. And
for stem cells, you really need to have some training, I would assume, or experience.
Yeah. So especially one of the most important things is properly harvesting them. So just recently, Terrell Owens actually had a stem cell treatment, and then he decided to blast it at the TMZ. And then, I guess I can say it because they did it, a media blast. It was at the Beverly Hills Orthopedic Institute. But the way that particular provider was harvesting it, it was just hard to watch because it was wrong techniques. Every bit of it. To, ex-professional player. Right? And then they were going to with one site, and first of all, they didn't even harvest it properly. It was going to inject it like in 12 different places. You can't get enough stem cells to inject 12 different places at one setting. Ever. And so it was embarrassing. And so that's why you need to go. Just because they say they do stem cell therapy, you got to do your due diligence. You got to check them out. And are they using the right tool? At least, and then also, they put the Terrell Owens, it was a general anesthesia. They put him to sleep to harvest it. I mean, that is going way too far. Maybe they were afraid that, he's a professional athlete,
right?
And they don't want him to feel the pain and things like that. I mean, and we ask patients all the time, as we're harvesting, how much pain are you having?
Gotcha.
Maybe 1 or 2 out of 10. That's it. And it's all done under local anesthetic.
Really?
So you don't have to go to sleep for this.
Interesting.
For none of the patients that we deal with, do we put them to sleep. You don't have to. Unless it's in a surgical setting, they're actually having surgery, then they're going to be put to sleep. But going back to what you were saying a second ago, when someone is at the point where they are desperate for pain relief and they're looking for stem cell therapy, one of the other frustrating things we're seeing out on the market now is we have people that are pushing these amniotic stem cells. And it's frustrating because inside of amniotic fluid, there are 0 stem cells. And so the other part about it is, you have people who are not trained in stem cell therapy that are, nurses that are injecting. And I think there's absolutely an absolute place for nurses and how they're injecting and whatnot. But when you start, charging these crazy prices for growth factors when a patient is expecting stem cells that regenerate, that's frustrating to us because it's very, I call it inappropriate. I'll feel comfortable saying that.
So maybe, you talk about growth factor, right? So when we talk about stem cells, I think there's an array of things that fall under that, right? And maybe you can go through kind of the different ones.
Yeah, great point. So a lot of people think stem cell is growth factor and also platelets or stem cells. But if you go into the current market, there are a few things. Like Bernie stated, amniotic stem cells. Well, that's how they're marketing it. There is no stem cells, right?
Zero.
And it's mostly, they derive the either amniotic or umbilical cord stem cell is driven from the placenta. So mom who's having a baby with C-section, and then they get all the testing done before, and then they donate it, and then through that they're trying to harvest it. And so what they end up getting is mostly either fluid or they develop into a patch, but it's mostly growth factors, right? And then when the third party did the study, there's really no living cells. So there's no stem cells. So if you say you're actually providing growth factor, then it makes perfect sense. But when they're actually, marketing to the public, saying that they're providing stem cell therapy, I mean, that's fraud.
Wow.
Right?
It's frustrating because patients are, just like you were saying, when a patient goes to a doctor, whether it's a plastic surgeon, orthopedic surgeon, a chiropractor, a pediatrician, and I thought this before I got into medicine, that a doctor's a doctor.
Yeah.
And so you trust the doctor. And so it's frustrating because they're targeting patients in desperation for pain relief. And so, again, just like Dr. Juan said, if someone's going to market, hey, we're doing growth factor therapy, man, good. But they at least know up front.
Right.
But it's frustrating to hear amniotic stem cell
And there's a lot
therapy
of
is not.
limitations to growth factor. It's not regenerating.
I was
at
going to
all.
say, I'm sure they treat inflammation and other things,
Correct.
right?
Yeah,
but they
absolutely.
don't
Yeah.
actually regenerate.
They
There's a
don't
place
actually
for
regenerate.
there's
Yeah.
a place for amniotic fluid, no question about it, and there's a place for growth factors. But when you're talking about full blown regeneration, there are no MSC cells that are going to turn into anything you need them to turn into. It's just not. It just doesn't exist.
Yeah, even somebody reached out to me this morning on social media and Facebook. He said, I got a placental-driven stem cell treatment. It didn't work. I said, well, you didn't get a stem cell therapy. Okay, you got a growth factor, and then he had a pretty significant arthritic knee. And of course, it wasn't going to work.
Yeah.
And so if you're going to use a growth factor, and even let's say platelet-rich plasma, if it's tendon, a ligament, you probably have a better chance to work because you're really decreasing the inflammation and allowing the healing to happen. But if you're doing something like arthritic knee, arthritic shoulder, arthritic hip, it's just not going to work.
Yeah.
And so that's why you really need true stem cells.
Yeah.
And with stem cells, there's only one option in this country, which is a bone marrow-driven stem cells.
And what'll end up happening? So inside of PRP and instead of amniotic fluid, there are anti-inflammatory properties without question. So it's just like anything, and no physician is going to tell any patient. And I mean, I'd feel confident saying this with Dr. Juan here. No doctor will say this is guaranteed. This surgery is guaranteed. But if you do the protocols and do everything right, there's a good likely chance it'll work. When it comes to these amniotic injections, and again, I think there's an absolute place for amnio. There are anti-inflammatory properties in there. So when it's injected into a joint, it's going to reduce the inflammation by the fact that there are anti-inflammatory properties in there. And so a few months later, 6 months later, just like the message he got this morning, when a patient goes back to the physician and say, hey, it didn't work. Well, you got to out because I didn't say it's guaranteed.
Gotcha.
It's frustrating because it's an investment.
Well, because they thought
financially.
they were regrowing.
Yeah,
Right.
that's
And
what they
they're
thought.
So maybe you could talk a little bit, since we touched on this. My next question is: so let's say I treat something, my arm, my bicep, whatever. How long does it last forever? Does it last as long as I last? Right. When does it go away?
It'll outlast you. It'll outlast you.
I don't know.
So it really depends. So it's even with stem cell, even though you're regenerating, I compare like you patching the tire. You patch the tire. And as long as you're living, as long as you're driving, that tire is going to continue to wear out, right? And so you may need a boost shot, let's say a year later, 2 years later, 5 years later, but you're naturally going to be degrading the articular joints, and so you may need further treatment. But you're able to avoid surgical treatment.
If you think
I
about
think that's
it,
a big point.
no, that's a great point. I mean, when I talk to patients or when I talk to people about cartilage, I mean, if you think about a tire, no matter how expensive the tire is, over the course of time, it wears out on the inside, outside, middle, just by default because through use. Our cartilage is exactly the same. No one in the world walks completely anatomical, or we'd probably have no cartilage problems. We jump around, we work out, we play tennis, we play soccer, we play football, we do gymnastics, whatever. And so what ends up happening is we start creating more pressure points on one side by just walking around. And so that's the whole thing about it. But different things that we believe in through nutrition and supplementation. And I mean, if you maintain that, man, you have a high likeliness of needing it a lot, not as soon, but it's like anything, everything wears out.
Yeah, there's no such thing as magic bullet, right?
Yeah.
And so you do have to incorporate, not just getting the stem cell. That's why we're providing the comprehensive care. And so we get the right type of regenerative nutrition in. We also the supplement, and as well as a proper rehab. And so it's changing the lifestyle. If you want to be active again, it's not just about immediately taking the pain away. And you can do that. But then after that, if you're not changing your lifestyle, it can quickly come back.
Sure.
We want this treatment to last you as long as possible. And then we can't force somebody to do it, but we provide the education and counseling so then they can change their lifestyle. So they maximize the opportunity for success for stem cell therapy.
Yep.
So I think a really good point there was, if I have like a rotator cuff injury and I get a shot and it lasts 2 years, then I may need to come in and get another booster, a couple years later. But I didn't have to have surgery, which who knows what
that's
that would
exactly
do.
right.
Yeah.
Right.
Who knows what that could do to your shoulder or
That's.
your knee or
I mean,
whatever,
if you ever go online and you look up like hip replacement surgery, like
Oh
they
my
actually
God.
have videos of what it looks like.
Yeah.
They are literally cutting you open.
Yeah.
Yeah.
And ripping things apart and then putting it back together
Yeah.
in the way that it's supposed to be, and then leaving you to
there's your
heal
there's your
there
leg.
you go.
There you go.
It might work.
It might work.
We'll
You
see.
do realize that although you have to look for the videos, what it looks like, you're on TV and all media, you're finding plenty of lawyers are saying, hey, you want to sue
That's
those
right.
companies for the joint replacements because they're faulty. I mean, and they're not all faulty by any means. They work, right? But it'd be horrible for you to be that minority the patient didn't work on.
Right.
And you're
man.
having to sue
Well, and I
because
think you
can't do
made a great
anything.
point. Like, what's before surgery? Shouldn't
Yeah.
there be something before I have to tear open
Yeah.
my leg?
There should be
You
something
know?
that needs to be done. And also total joint replacement. On average, lasts probably 10 years maximum. And some small percentage, it may last a little bit longer, but greatly less
That's
than 10 years,
interesting.
right?
Yeah.
And then you're going to need a revision. As you're taking out the old implant, you're going to lose a lot of bone.
right.
And so you're going to revise it with something that's bigger implant. And then after that, 10 years later, you're going to need another replacement.
know that.
And
Man.
then,
Yeah,
then you're going to lose even more bone. So then what are you going to do?
Gotta do it
You don't
again.
need
Either
bone.
way, we're talking about having to go back and
Right.
tune it up.
Yeah.
Right.
Yeah.
Right.
And
I mean,
so you need to push off the surgery as long as possible. But
Right.
along with that, there's a specific, I believe about 5 or 6% of patients who have total knee replacement end up with amputation because of infection, right? They can't treat the infection. So, I mean, do you want to be that? So
Yeah.
you want to avoid surgery as long as possible. Try
Amen.
all your methods. Right?
Amen.
Yeah.
Yeah.
And then eventually, you may worn out your cartilage so much that the stem cell therapy may not work. But you never know. Maybe
Right.
10 years, maybe 20 years. Maybe you won't need total joint replacement.
Yeah.
Right?
So on average, when somebody comes in here, I mean, how often are we able to do some sort of a stem cell treatment of that's I guess working?
What do you mean? How often?
Like 9 out of the 10 times somebody comes in, they're a candidate.
Dude, most of the people who come in are a pretty good candidate because
Yeah.
at that point, they're desperate, right? I mean,
Right.
you don't have to be so desperate to where there's 4 stages, stage 1, 2, 3, and 4 of the generation of cartilage. And correct me if I'm saying that wrong, but you don't have to go straight to being a 4. A patient, when they get to where their discomfort is between a 2 and 3, you're a candidate still.
really?
Without,
Yeah.
Yes, absolutely.
But I want to clarify something though. So most people who come in, just because they have a shoulder pain or knee pain, does not make them a stem cell therapy
Right.
candidate,
Yeah,
right?
that's right. Yeah.
And so a lot of people come in thinking that, okay, I'm just going to jump into this stem cell therapy without doing any conservative treatment, and I'm going to get this magical treatment done.
Gotcha.
And so, from what we've seen, probably about 60% actually had real condition. And then
Okay.
off of those people, maybe about 9 out of 10 were actually a candidate.
Gotcha.
And so
Okay,
if
that
you
makes
consider
sense.
all the patients that come in, it's about maybe 50%.
So 40% of the time we can use one of these other treatments or
Yeah.
nutrition
Yeah.
or rehab
Yeah.
or something like that.
That's
Yeah.
where the evaluation comes into play, right?
Yeah.
We want to evaluate them. I mean, we're not jumping in saying, "Yep, stem cell, stem cell."
Gotcha. Right.
We are saying, "Let's look at you."
Yeah,
And
we
let's
have to
see
be a
everything.
doctor first, right? Before anything else, doctor. We're
Yeah.
not here to just inject somebody.
Sure.
So I think that's why I say about over 40% of the patients who came in, somebody who came in with rheumatoid arthritis, could she potentially become a stem cell therapy candidate? Yes. However, she really hasn't done any treatment whatsoever. And that's why I spent about an hour counseling her about nutrition, because especially rheumatoid arthritis, which is part of the autoimmune disease, we can reverse it just purely from nutrition. Right?
Yeah.
It may take her about 3 months to 6 months to gain a really full effect, but she doesn't necessarily need to have this treatment right away. So let's try the nutrition first and then see what happens. And then because I've seen so many patients who've been able to reverse the rheumatoid arthritis, other chronic disease, just purely from nutrition or also physical therapy. So do those things first. Maximize the conservative treatment before you actually get anything. Even if stem cell is still invasive, it's minimally invasive. It's not non-invasive.
Right.
So try all those non-invasive treatment options first before actually.
And I have
getting
to
the
believe
therapy.
that those treatments are something, they're kind of on the preventative side, right? So you're going to want to continue those probably even after the
Oh, absolutely.
treatment, right?
Yeah, just because that's why I hear some centers already doing stem cell treatment for autoimmune disease and they get cured. It doesn't get cured. It may help them immediately, but if the patient doesn't change their lifestyle, it's going to come back.
Right. So, I know one thing that when we talked earlier, that the nutrition parts of this, right, are a big piece. So maybe you could kind of touch on a little bit with regard to recovery, prevention, with stem cells specifically, what type of nutritional components are key and what can people do on their side?
Yeah.
Right?
I'll say this real quick. When I approached Dr. Juan about how do we separate ourselves, how do we create something different, because people can do stem cells. If you're an orthopedic surgeon, technically you can do stem cell. You can pull bone marrow aspirate and get someone to spin it down. But we wanted to create a true solution. And so one of the things when I'd hear his talks once a month, and it inspired me to full-blown, like I was saying earlier, become vegan, because I believe so much in what he was talking about and just the science, and he really is compelling when he talks about it. When we were talking about how do we create something unique to really create a solution for these patients that are in desperate pain, we found, and it was easy for him because he lives a lifestyle through and through as a vegan. We found that through proper nutrition, it's the same thing. You're not going to put diesel fuel or 87 octane in a Lamborghini or Ferrari. You're going to put the right type of fuel in there. So we wanted to create the types. We wanted to help patients be able to learn the correct nutrition to be able to allow more blood to flow. Because even when it comes to these diseases, most people, they treat the effect instead of the cause. Right. And so it's been a major player. Stem cells is a big part of it, but nutrition is equally as important. Dr. Owen, what do you think?
Yeah, so one of the things I want to clarify is rather than being as vegan, I am vegan, but I live a whole food, plant-based lifestyle. That's a big difference. As I stated before, there are plenty of vegans who are not healthy. They do it for ethical reasons. For me, I do it first for my health and then all my patients' health, and then also to save the planet as well as compassion for animals. But through living that lifestyle, I've done significant amount of research. What I've done was, I'm in this operating room all the time. I get exposed to radiation every single day. So chances of me getting cancer, for a patient, it's a one-time thing, right? Floor scan, low-dose radiation, but I'm being bombarded with radiation every single day. And so that's where my research started, going. And finding ways to prevent cancer. We all have cancer. Every single one of us who's sitting in here in this room actually have cancer cells floating in our body. But is that going to become clinically significant? And for many patients, it will, especially if you have some family gene related or your lifestyle. And my lifestyle as a surgeon, I'm getting exposed to radiation. So I needed to find a way to minimize my risk. And I found the best diet and lifestyle possible, which was a whole food plant-based. And as I was doing research, then I found the nitric oxide. And then there's a lot of research that was done within the stem cell community about nitric oxide. Two spaces have not connected, and they're beginning to. But it is critical for you in order to mobilize and activate the stem cell, you need nitric oxide. And so nitric oxide is almost like close to fountain of youth, because not only it mobilizes and then also activates the stem cells, but it also makes your mitochondria, which is the powerhouse in your cell, much, much more efficient. And also activates the telomerase, which builds the telomere. So telomere is basically, it tells you your genetic aging. Right? So the DNA, you want it to be as stable as possible. So there's a cap. So imagine a shoelace, and there's a plastic cap at the end, right? As you live, that plastic cap gets shorter and shorter and shorter and shorter and shorter. And then what happens at the end? It's just, if the plastic cap is gone, falls off, what happens to the shoelace?
Yeah,
it just gets frayed, unravels, right? That's death. So what they found was if you increase the nitric oxide, it activates the telomerase. It increases the telomere. So that is a true genetic anti-aging. Wow. The longer the telomere, genetically younger you are, right? And so that is a true fountain of youth. But what creates the nitric oxide is there's two different pathways. One is nutrition, And another way is your arteries. So inner lining of your artery is called endothelium. It generates nitric oxide. Okay? But unfortunately, as we age, we do so much damage to the vessel. By the time you're 60 years old, you lose about 85% of your ability to produce nitric oxide. And so nitric oxide also, some of the thing it does is it vasodilates. So it increases the blood flow to where it needs to go. And then it also helps with diabetes or heart disease, gives you more energy. There's so many health benefits that it's critical to have nitric oxide. So if you don't, you're getting close to death, right?
So I do have a question about that. So with nitrous oxide, you see that a lot in supplements, right? Is that the same thing? No. Okay.
No,
I can already
must be identical.
read it on. Yeah.
Well,
I can
so-
read this expression like, oh my god.
Let me talk about this. No, so,
Meathead.
so typically when you think of nitric oxide, right? We when we were looking, so on top of the stem cells, when we were talking about nutrition, we started looking on the market for nitric oxide that we could provide to our patients. The problem with nitric oxide is whenever you think about it, it's usually tied to a pre-workout. The whole idea behind nitric oxide is you take it, it dilates the arteries, gives you the blood flow, the pump. The downside to it is just, it's ironically crazy. It comes down to the marketing dollars that these companies have. There's caffeine inside of nitric oxide. Inside of these pre-workout nitric oxides, and what it does, it's a vasorestrictor. So as we're trying to open up the arteries, you're restricting it. Really? So it just works completely against itself. So what we ended up doing, out of frustration of not being able to find anything, and everything else in the market on top of having the caffeine in it, was incredibly underdosed. So what we did is we worked with a formulator, and we formulated our own nitric oxide. And we're excited about it because it's not underdosed at all. You can use it as a supplement, which we're using it. The whole reason we're having it for is for our patients. We want to dilate those arteries so that blood flows to it. The oxygenated blood gets to where the stem cells are, gives them the most perfect environment to regenerate in. But you can also use it for working out. So take about an hour before you work out, and you'll get the pump, but you'll get the exact amount that you need to get it in a very healthy way.
Yeah, also you need just more than the nitric oxide supposedly producing substance. You actually need a lot of cofactors in order to actually produce nitric oxide. And so that's what's lacking. And like he said, a lot of them are underdosed. And then just because you have certain component doesn't mean it's going to, in the formula of generating the nitric oxide, doesn't mean it's going to actually produce the nitric oxide. So it's a lot more complicated than that. And then the other method is nutrition, which is one of the most important things, especially as you age, since your vessels are damaged. Supplements to push you even further, right? Because your vessels are so damaged. But then the other method is through nutrition. And it's simply dark green leafy vegetables. As you can see, that I'm drinking my smoothie all day long, right? Not only to generate nitric oxide, but also to improve my gut health, right? Gut bacteria is responsible for like 80-90% of your health. And so they want fiber. And then also dark green leafy vegetables have tremendous amount of micronutrients that you need. But one of the most important thing is its ability to generate nitric oxide. So it has a lot of nitrate, and then it gets converted to nitrite in your mouth by bacteria. And then once it goes into your stomach, because it's acidic, it actually produces nitric oxide. So there's a certain step that you need to take. But mostly, overall, you need to decrease the inflammation in your body and then increase the nutrients so that you can actually mobilize and activate the stem cells.
Gotcha. Using all these green vegetables to feed your body, right? And so I was thinking to myself, and I wanted to know if this is true or not, is by, putting in this nitric oxide, putting in all of the vegetables, are you actually helping your current stem cells in your body? Like, is it your current regeneration, whatever you have in there, is it getting better?
Oh, absolutely.
Yes.
Absolutely.
Without
Because,
doubt.
your body needs the nutrients. Most of the Americans, probably about 70 to 80%, are deficient in micronutrients. And so by eating more plant-based, that's where it's micronutrient really, really rich, right? And so you're feeding your body, you're feeding the stem cell that has the ability to repair and then differentiate into a specific type of cells that is able to repair yourself.
Interesting. So eat your damn salad.
Yeah, eat salad. We're going back to that.
It's true. If you think about it.
Yeah. And you mentioned how it changed you in such a short period of time, right?
It was amazing.
It changed me too. It did the exact same thing for me because your blood cell count was low, right?
Right.
And you said you started eating salad. I thought about it and I'm like, I think it's been like a month since I had an actual salad, and I ate it too. had the same effect.
Yeah. So
both of us now.
In case anybody
eats
didn't
out.
see the other episode,
Yeah.
we were testing using glucose monitor, Keto Mojo, and it actually showed the red blood cell count and what's the enzyme? Is it hematocrit? Hematocrit. Yeah. And I noticed they were really low, and I'm like, I'm a pretty healthy guy. I work out. I own a gym for God's sakes, And I was like, why the hell is it so low? And so then I started eating the greens after I came and watched your session, right? And all my numbers and they continued for weeks to go up and up and up. And then like every day I look at them like, oh my God, I can't believe how high it is. Because it was like I was anemic essentially. And now it's like way off,
You think about it from the standpoint when blood pressure's high or whatnot, besides being prescribed a pill of some sort, when someone adjusts their diet, there's a lot of things can happen through it, right? They can gain weight, lose weight, they can do all sorts of stuff. The same way when we do whole food types of plant-based nutrition, we're putting the right types of food that are reducing inflammation, that are raising your nitric oxide levels. It's all over health, right? When you eat meat, as we were talking about earlier, man, meat is an inflammatory for all of your organs. And so what we're doing is we're putting the right nutrition that absolutely, it's going to make you healthier. You're going to feel better. You're going to feel sharper. I mean, you were able to finish in a weekend.
That was the big thing. I mean, I had the blood test telling me that the stuff I was eating was making a difference, right? Which is, it's kind of hard. Like, you're going to get micronutrients. Sure you are. Right. How do I measure it?
Yeah.
Right. But then I had a measurement that told me it was. But then the big thing for me and why I will never go back to not eating salads, eat your damn salad, was that it was like, I had a phone camera and it was out of focus and I touched the center of it and it focused. And I was like, I just noticed it one day. I was like, oh my God, I can actually think.
It's unbelievable. It's unbelievable.
Well, I mean, with
crazy.
our last cheat meal, we ate.
Oh my God.
We ate shit and we felt like shit.
Yeah.
I mean, it was pretty apparent right after.
Yeah,
right
they've
after
actually
coma.
done a study. University of Maryland did a study. So they got a bunch of college students, and then they had them eat the, egg muffin and then the potatoes, and then immediately they did something called a vascular study, and after they increased the pressure, so it stopped the blood flow. And then afterwards, they'll let it go and then see how long it takes for artery to function normally. It took them about 3 to 4 hours.
Oh my God.
So
Wow.
it freezes, even young as they are, it freezes, essentially immobilizes their artery.
Right.
And then if you eat dark green leafy vegetables, no difference whatsoever, right?
Well-
and so it's the fatty meals has a tremendous negative effect on your body, and you're doing that every single day. So people have bacon and sausage and eggs in the morning, and then your vessels are damaged, and for 3 to 4 hours, and then you have lunch, and you're insulting it again, right? You have your lunch meat and whatever milk, and then 3 or 4 hours later, you're eating dinner, and so you're constantly inflaming your body and inflaming your arteries. You're doing damage every single day, right? And so that's why Americans are suffering from chronic disease. We're spending $3.2 trillion a year, and 80% of it can be avoided.
Yeah.
It can be completely prevented or reversed.
That's what I was going to say. I mean, 70 to 80% of diseases are chronic and preventable, right? Don't have to happen, right?
Yeah.
And just by changing the diet. Not only that, but I think it's something like 70% of American men are either overweight or obese.
Yeah.
Right? So these are huge numbers.
Yeah.
Huge numbers.
70% overweight or obese, and an additional 8% are severely obese.
Amazing.
So 78% of Americans are overweight, obese, or severely obese.
That's insane,
Yeah.
right? And it's all about food.
It's choice.
It's a
100%
choice.
It's a choice. You choose to give yourself.
Well, and think about. I'm sorry. Go ahead.
No. I was saying, type 2 diabetes. All of these are completely reversible.
Well, think about if let's say you're a doctor or you're Bernie, right? And you're operating at this level without that, and then you add in the plant-based diet, the clarity. You're going to naturally rise to some other higher level, right?
And absolutely. And so that goes with. I think we're all ignorant to what we don't know. And I think some of the stuff that we've heard, like we had a patient that we were doing a consultation with, and this gentleman, he had a horrible arthritis in his shoulder. It was really degenerative, like very, very bad. The biggest concern they had, not with the needle to take out the stem cells, not with anything else, their biggest concern was the nutritional part of it. How did they do it? It was really an interesting conversation out, because I would never have thought I would have thought that'd been the easy part. That was their big concern. And that's one of the reasons we do what we do as far as with nutritional counseling, because we are here to walk with the patient through this journey for a full solution. And if you don't know how to do it,
Yeah.
you don't know how to do it.
Yeah.
So that's why what we do is we really break it down. We explain you need to be eating green leafy vegetables, eat this fruit, eat these legumes. There's different things. What makes it the hardest to transition is not the meat or not this, it's just knowing how to do it. I mean, there's some transitioning with the meat, but it's really knowing how to do it. And so we really make it a point to focus on giving the knowledge, because what will end up happening is the stem cells will start working. Then the nutrition will be working. They're going to feel better. Their BMI is going. So the stress that they're having, as we're talking 78% obese and overweight, they're causing all this extra stress on their joints. So by switching to plant-based, not only are they going to feel sharper, they're going to reduce inflammation, their BMI is going to go down. So it's going to create a lot less stress on these joints they're having, allowing the stem cells to continue working. It's just, it all coincides together.
Yeah.
So
You know what I promote is the best diet is a whole food plant-based, but not everyone can do it. And I recognize that. But if you can minimize the meat consumption and animal product, which causes so much inflammation, it causes so much chronic disease, it causes cancer, heart disease, diabetes, autoimmune disease, just minimize it. But more importantly, I always state, it's not about what you don't eat, it's all about what you put in your body, right? And so eat more dark green leafy vegetables, eat more fruits, vegetables, beans, whole grains, just like what your mom told you when you were young, right?
Right.
More
Turns
fruits
out to be right.
and more vegetables. Damn it, they're always right. They're always
broccoli.
right, right?
The broccoli.
Always back to that.
And broccoli is a magical food, right?
Yeah.
And so, but you got to really eat a lot of fruits. Even diabetic patients, we focus 70% carbs. People go, what?
Yep.
When I made a statement in Facebook, I said, heart attack is a choice. It's your fault. You did it. No one else. You did it. It's your choice. And then classmate, he's a very talented trauma surgeon, and he said, what are you talking about? How about their age, gender, right? Their race? It doesn't matter.
Nope.
You can reverse it. We've documented that by nutrition, you can turn on or off the genes. Even you have a gene that may make you more likely to develop certain cancer, you can turn it off purely by nutrition. And most Americans are constipated. They're eating fiber pills, which doesn't even work, right?
Yeah.
And then and that's part of the reason why they're going to get colon cancer. And so many of the cancer can be prevented also. And so by the time you get it, it may be a little too late. So why not take the time to eat better?
Yeah.
And now prevent it.
Yeah, and it's exactly right? We try to be proactive instead of reactive. And at this point, at our ages, we start having to be reactive, right? But the other player in this whole deal is media, advertising, right?
Yeah.
Oh, well, I'm not going to eat pig bacon. I'm going to eat turkey bacon. It's just these things that they're just as bad and it's just as processed.
Right.
And so
Arugula bacon.
Arugula bacon.
Arugula bacon. That's right.
So now you're going
I'm gonna
plant-based.
patent that.
You're going plant-based now. You're going plant-based.
Well, I
It's
mean,
fine.
you mentioned earlier too that some of the outlets, I guess, for somebody to make a transition, because I'll admit I was ignorant until I
Yeah,
became reactive, right? Like
Yeah.
I was sharing a story about a couple years ago where like all my blood test results, all of a sudden I hit 30. And everything isn't working the way that it used to, and then
Crazy
now I
how that
have
works.
to. Oh yeah, I know,
Crazy how that works. True.
Yeah, I get to be part of the club now. So
It's not a good club.
I hear it's a lot of work.
It sucks from here on out, man.
Go to a different club. Go to a different club.
No, but like, so being reactive and then going through like kind of this journey, and we're continuing to learn and we're continuing to discover these things where nutrition is that big piece, and we've tried, I mean, being fitness people, we've tried a lot of different types of diets, right? So, and now we're hearing that maybe,
I think it's a couple things. And one of the reasons we've been doing, the blood testing, right? And we do the cheat meals, and we're going to show what it feels like. We're going to bring on guests. I think we really need to investigate some of this plant-based diet stuff, right?
Yeah.
Because, people, but when they feel different, it's just one of those things. You have to feel it.
Absolutely.
And if you've got some science, even just a little blood monitor that tells me, oh my God, something changed.
Right.
And by the way, when I don't eat stuff like that, it goes back down. You can't just eat it and you're good for a week or two.
Yeah.
No, you have to keep doing it, right? But now that I've experienced the benefit, I don't ever want to go back.
That's right. It's exactly right. So, it goes into, when we're talking about stem cell therapy, we can put the stem cells in there. They're going to do what they do. But what we want to do is we want to fuel them stem cells. We want to make it to where it's the perfect environment. So, again, as you're eating the plant-based nutrition, the whole foods, it's going to help open up to where the oxygen is flowing, blood is flowing to where the stem cells are. It's going to make you feel better, anti-inflammatory. BMI is going to go down. Everything's going to get better and better and better. And at that point, it just becomes a lifestyle. I mean, the whole idea was there's a transitional point no matter who you are, because you have to learn. This is learned, but we've learned how to be unhealthy.
Pay for it now, pay for it later.
Yeah.
So now we have to unlearn and then learn the new way to do it.
Both patients and also, unfortunately, physicians, they're always treating the effect, right? Not treating the cause.
Right.
So it's, in diabetes is perfect example. They give them metformin, tell them not to eat, sugar. Well, sugar is bad, but even carbs, right? And then their goal is to decrease the blood sugar level. That's not treatment. That's not treating the cause. The real cause is all the fatty tissues they have inside their skeletal muscle, as well as their liver. And if you get rid of that, the insulin, most people seem not to understand the insulin resistance. I'm only a spine surgeon, right? But I don't understand how the endocrinologists and then also the internists are not, hopefully I'm not making enemies out of them, but not treating the actual cause. It's because we just don't understand the nutrition, right?
Yeah.
And so by, decreasing the amount of fat intake. So most of our patients who are diabetic, they go on 70% complex carb diet with less than 15%, hopefully 10% fat, and then about 15% protein. It takes them about 3 months to significantly decrease their medications because they lose insulin resistance. Insulin actually works in their body. And so it's actually treating the cause, not the effect. Yep. And so we want to do the same thing in people with joint pain, osteoarthritis, ligaments. We want to go back and we want to regenerate it, right? And so we can't turn the time back around, but giving them the proper tools so that their body can repair itself. But it's not just about the stem cell. If you just put the stem cells, but don't put the right nutrient, it's just like planting a flower in a concrete. It's not going to grow. Right? You can put it in the soil, but if the soil is good and then also you have the right fertilizer, it's not going to grow.
Right.
So that's what we're trying to do. We're not just putting a flower in your joint, right? We're going to make the soil into a proper soil, and also we want to feed it with the right fertilizer so it can bloom.
Now, one thing, because not everybody that watches this is going to be able to, to come down here, but I know you guys have invested in some equipment so that it can be specifically and precisely placed, right? So if you're going to go through the effort of getting it, you might as well put it in the right place. Yeah. Otherwise, the result, you say, doctor, it didn't work.
Yeah.
Right?
Absolutely.
That's what's going to happen.
So if they go to a center and says that they're harvesting stem cells without using either intraoperative floor scan or ultrasound, they should get out and run.
Yep.
And then if they say that they're going to place the needle blindly into the knee, no problem. We can feel the anatomy. Knee injection is easy. And without x-rays, intraoperative floor scan, or ultrasound, they need to get out, run. Because even knee, as simple as it may seem, because you can actually feel the joint line, but there's a fat pad. So sometimes you stick a needle in there and you don't even realize the patient has a big fat pad, and then all your injection could go into the fat. Then it doesn't get into the joint space, so it doesn't do anything. Right? And they've actually done the study even with the shoulder injections. It only the even trained orthopedic surgeon can place the needle at the right place only about 50% of the time blindly. So it's a 50-50 chance. So why would you go through that trouble of harvesting the stem cells, processing it, and then injecting it into the joint that's damaged? Why would you do it blindly?
Right.
So unless they have a floor scan or ultrasound to actually administer the stem cells, stop.
There's no point.
There's no point.
Wow.
It really is. There's no point. I mean, and again, at the end of the day, when you come to something, you go when desperate patients are going to certain providers, and their providers are saying, "Hey, no, it's okay. There's landmarks and whatnot." Man, why even chance it? Yeah. Like honestly, why even chance it? And so we've invested a lot of resources in having the right equipment because we want to make sure we want to guarantee that wherever that injury is, the stem cells are going to the exact area of injury. We don't play around with it.
And these aren't like huge, like random areas, right? I mean, you have to be really, I would think, pretty precise.
They're between your joints, so I'm assuming that the space that you can put it in there is pretty
huge,
small.
right?
Yeah, the space is really narrow, so you really need to be precise, right?
Right.
And so even knee is probably the largest joint that we
Can't
can
imagine
inject.
a spine for crying out loud.
But spine,
right?
well, you definitely can't do anything with spine unless you have an imaging.
Yeah.
That's why a lot of the centers are marketing just knee pain because knee is by far the easiest joint to inject. However, still, 50% goes into fat pad. And so if you want to inject and you want to go into the right place, also you mentioned ACL before. Now we were able to inject into the ACL, and without the fluoro scan, you can't do it. You have to place a dye and make sure that dye is inside the ACL so that it can reconstruct itself, right? And then without it, if you just inject it into the joint, it's not going to do anything. So that's why you need additional advanced tools, imaging guidance, in order to be able to effectively perform the procedure.
Yeah.
And you have to be very, very precise.
Wow, amazing. Well, so, I've learned an amazing amount today on how all this works.
I've completely changed my entire outlook on diet.
Well, thank God it's not so bad getting old now.
It might be a little less.
Here's
Slow
one
it
thing
down.
I'm going to give you, though, because you did ask, why is meat bad, right? So I'm a nerd, I'm a geek, and so I'm going to give you a little bit of science behind it, right?
Get ready.
And so
Okay,
people are
I'm here.
So people are always going, how about red meat, chicken, fish, all those, right? Especially red meat has a lot of carnitine. So once the carnitine goes in, your gut bacteria is completely, if you're a meat eater, completely different than mine. The way I respond to meat is completely different than yours because I don't have the bacteria that you have. You have the bacteria that digest the meat. And then what happens in your gut is it actually produces something called trimethylamine and goes to the liver and gets oxidized and then becomes trimethylamine, oxide. That is a very, very inflammatory property. And so that's going to cause the vessel disease and then many other chronic disease. That's what you want to avoid. So then somebody said, well, how about fish? Okay. Well, how about eggs? Well, they have something called choline, right? Choline goes into your gut and your gut bacteria converts it into, guess what? Trimethylamine, which gets oxidized in your liver and becomes extremely inflammatory. And so those are the reason why the animal products are bad. The plant-based protein does not have the same property. And interestingly enough, I don't know how they were able to do this. They got the vegans who haven't eaten meat for many, many years and got them the meat, right? Their body didn't produce the trimethylamine because they didn't have that gut bacteria. Okay? Humans have about 23,000 genes in our body. That's human genes. We carry over 3 to 8 million genes that derive from microbiomes. So microbiome is really where it's at. When we're eating whole food plant-based and then eating fiber, it's not for us. Okay? All that fiber is actually feeding the gut bacteria, and then so that it can actually do the same, the necessary thing to keep us healthy. Less than 4% of Americans are eating minimum daily dose of fiber. Less than 4%, right? You mentioned that you haven't eaten salad sometimes, like for weeks at a time, right? So you're just not getting enough greens and the micronutrients, but most importantly, fiber. All the plant-based food has fiber. Beans got fiber, broccoli's got fiber, right? Fruits got fiber. So you need fiber in order to, it's not for you. Fiber is really for the gut bacteria. Okay? That's how you're going to maintain great health.
Wow. So eat your damn salad.
Eat the salad.
Eat the damn salads.
And here's another one. I'm going to give you another one, right? So then, you're going to be healthy. You don't want to eat fried food. So you're going to grill, right? So you slap the meat or your chicken on the grill, right? When you grill, what happens is the meat itself, with the high temperature, changes and produce something called heterocyclic amine. And once that gets oxidized, it's a carcinogen, right? That's why the higher consumption of animal product is directly related to a high amount of cancer. So because you're every day consuming carcinogen. So one of the best way to avoid cancer is to avoid toxin, right?
No, that's interesting. I mean, I'm thinking too, and this might be a little bit of a segue, but also you hear some of the folks that say something like, our bodies are designed to be both, right? Like we're omnivores or whatnot, and then they track back our whatever historical lineage to wherever we came from, and then they make this whole like, oh, we've evolved to eat both type of argument. I mean, how does that influence?
Yeah. So here's the thing. So you're talking about way we're designed. We're actually designed as a herbivore, right? Versus omnivore. So if you look at the lion, right? They got huge canines, right? And then they can only just grab like this, right? And then their digestive tract is extremely short, so they can process the whatever they're eating really, really fast because meat can be very toxin, right? And then also they produce a lot more acid. Their stomach is a lot more acidic than ours, so they can digest the food a lot faster. Versus human, our teeth moves both vertically as horizontally, and then it grinds so that we can actually break down the cell walls of the plant-based food. And then our digestive tract is really, really long. right? Much longer than all the omnivores, right? And so the longer the meat stays in our system, right? That's why we get, like colon cancer. So the way our body is really designed, we're designed to be herbivore, not omnivore, right? And so they try to say, well, Paleolithic time, we found that, they were eating some animals. Do you think back then they were able to efficiently chase down the animals, right? We can't run fast, right? And we have to, until we were able to develop some weapons, we couldn't kill the animals. And they were mostly eating, berries and different fruits, and they were gatherers. They said, well, they were hunter and gatherers. Well, they were mostly gathering rather than hunting.
I see.
Right? That is our true ancestors. So maybe once a month, maybe once every few months, they were able to eat meat. That's the extent of it. And so, for most listeners and most viewers, may not be able to do 100% whole food plant-based. But again, try to minimize it, minimize the animal products as much as possible, especially dairy. That needs to be cut out
altogether.
100%. But eat things that are going to be, bringing you a lot of nutrients to bring your health back. So, I always say dark green leafy vegetables, and I soak my body, bathe my body in dark green leafy vegetables all day long with my smoothies.
One thing I hear Dr. Wan talk about often is for those who, they're trying to transition, instead of making the meat the main portion, make it your side dish. I mean, it just those little things help. So if you still are you're trying to do whatever you could do. I mean, I always tell patients and people, man, if you're doing 10% better, 10% is better than zero, right? Yeah. But if you could take any type of meat as you're trying to consciously work on getting out of eating any kind of meat altogether, make it your side dish. So instead of a 10, 15, 20 ounce steak, make it a 6, 8 ounce steak. But if it's a 6 or 8 ounce steak, have a bite.
Yeah, I noticed what you mentioned earlier too about the section in Whole Foods where they actually have like
vegan options.
Vegan meat,
right,
or vegan meat. And you mentioned I haven't had it before, but I'm actually open to trying it now.
You have a healthy day instead of a cheat day.
Yeah.
It could be a cheat, unhealthy, healthy day. But no, I was impressed. I went with my kiddos, and I'm not kidding with you. I bought one of every single thing they had because it was like $300 worth of vegan plant-based stuff. I was serious about the transition, and I wanted to see what everything tasted like because I'd never even explored it, and I was pleasantly surprised.
Really?
I mean, so they have different types of deli tofu, types of like tofurkey. I mean, and it is very similar in taste and flavor to real deli meat. They have all sorts of bratwurst, sausage. Like it's pretty cool. And then they have sausages, but it's all plant based. So although it's not. In the best way to do it is real whole foods. Man, it's a great transitional way to go from meat to plant-based.
Yeah, just try to eat things that are more whole food. And, try to minimize processed food as much as possible, right? Eat the food that's been created by God, the way God created, right? That's probably good,
I noticed getting rid of dairy was a big change. I mean, that was a big positive difference for me. Just getting rid of all the dairy. Yeah. That made a big difference.
There's so many different types of milks now, man. They make, there's hemp milk, there's rice milk, there's almond milk, there's soy milk. Same thing for ice cream. Now, Ben & Jerry's, because I've always been a big ice cream guy, Ben & Jerry's created their vegan line. So they use almond milk. And so there's options. There's coconut milk. There's rice. There's coconut ice cream. There's milk ice cream. There's almond ice cream. There's all sorts of different ways to do it.
And I think the idea with all of this is, why live suboptimally?
Yeah.
Right. Why?
Without question.
If I can eat stuff and just change my diet and get smarter, reduce my chance of cancer, lose body fat, all that stuff, why wouldn't I? Make some of those changes.
Honestly, and going back to your point about like media and influence and things like that,
maybe they're willfully.
I mean, and also politicians.
We don't know, but
even politicians, right?
Yeah.
Like for example, last year in July, so the congresswoman from Wisconsin tried to pass a bill where plant-based milk cannot call themselves milk. Right? She said it's hurting the dairy industry. So she spent all that money and the taxpayers' resources to change so that all the almond milk could not call themselves milk. Pea milk could not call themselves milk. And then, the coconut milk couldn't call themselves milk, just to protect the dairy industry. So does she really care about her constituents, about their health? Right. We all know it's pretty clear Now, the dairy is bad for you. Causes a lot of inflammation, causes cancer. And then if it's cheese, it's 70% saturated fat.
Well, it makes you fat too.
Makes you fat.
And but more than that, it's pus. There's there is pus in there factually.
Yeah. And so, but the politician, just like the media and then all the food industry, and why is she protecting the multi-billion-dollar industry rather than protecting her citizens?
There was when the Olympics were recently on, right? And it was amazing going back to advertising, right? So they had, and I forgot the exact ad, but it was a dairy milk thing, the official drink of the Olympics. I mean, I don't know if you guys saw that. It blew me away because, I mean, there's no truth to that at all. Right?
Every day I have patients coming in, they have osteoporosis and they had a compression fracture and then said, well, do I need to drink more milk? I said, cut out the milk. And then and they said, well, I have osteoporosis. I need calcium. Right? What they don't realize is dairy makes your body more acidotic, so pulls the calcium out of your bone. Right? So they've actually looked at the population that drinks a lot of dairy, milk and dairy product, consumes dairy product versus none. Right? There are more osteoporotic hip fractures with the population that consumes milk. More milk do you drink, higher chance that you're going to get osteoporotic fractures.
Wow. Well, let me ask you this. So if somebody wants to get some information, and they want to take it to the next step, or they want to go get an evaluation, or maybe just go, read something. Where do we send them? Where does somebody go to get,
Yeah, so you can go to our website. It's at www.regevitystemcell.com, and you can contact us on our social media.
And is there like a contact form on the website that they can submit? Somebody will get back to them or something like that. Is that right?
Absolutely.
And Regevity is Regevity. So it's combining the regeneration and longevity.
Gotcha.
Yeah.
Nice.
I like that.
Nice. Cool.
Yeah, it's definitely like I said. Any questions at all? I mean, this is our passion.
Yeah.
And so we really want patients to. But on top of regeneration of cartilage, ligaments, tendons, we want to change their life. We can absolutely, through nutrition, our supplementation, change their lives without question.
Well, we see it. At the gym, our population tends to be 35 and over, right? And it's probably about 60% male skews, and a lot of them had injuries when they were younger, or they've had a rotator cuff, or they've had an ACL, or they've had an MCL, or they've had something like that in the past. And they don't want surgery, right? But they don't know that there's something before surgery that can actually be really helpful and remove their pain.
Yeah. I mean, that's why we should probably mention, like, since you guys own the MMA gym. Like Justin Rand, for example, he was a UFC fighter and Bellator fighter, and he had a pretty significant degeneration in his neck and pain level of 7 to 8, out of 10. And one of his goal was to join Chris Long. I guess he won 2 Super Bowl with Philadelphia Eagles, and they're both humanitarians, and they drill water wells in Africa, and then also to free the slaves in Africa, and wanted to climb Mount Kilimanjaro so that they could raise funds. I think they raised about $450,000, right? And so they're going to be saving many lives.
That's amazing.
Oh yeah.
But he couldn't train. He was having so much pain.
Yeah.
So he had the treatment, stem cell therapy, and then within 4 weeks he was feeling well enough, pain level 1 to 2 out of 10. He could start train again. So he started climbing Colorado mountains.
He was training there.
And he was a little bit late because he really needed to train a few months before, but he was able to so we not only did the treatment, but also it converted his nutrition, and then along with the supplementation, he was able to go to Mount Kilimanjaro, Africa, and Mount Kilimanjaro, and he was able to climb, but not just climb. He was the first one to reach the top among that group.
Wow,
so
that's amazing.
It was a bunch of NFL players and then U.S. military veterans. But as a gentleman that he is, he's an animal inside the cage, but humanitarian gentleman. And then once he got to the top, he waited until the U.S. military guys, the veterans were there, let them pass, and then so they can touch the pole first.
Right.
But he did it 100% plant-based.
Really?
Yes.
Wow.
Yeah. Yes.
100%.
Super cool.
Yeah.
I mean, it was a great story to hear because when you're climbing, Mount Kilimanjaro, you're going to
Yeah.
probably, in my mind, I'm thinking I'm going to just eat whatever I can get my hands on because.
Well, that
you
was
know,
the question going through my mind when you're telling the story. I was like, I
Yeah.
wonder if he switched over to a
Yeah.
plant-based diet or if he was.
Yeah.
you know,
So I was surprised. He came back and he said, "You be proud of me." I go, "Well, I'm always proud of you." And he said it was 100%, plant-based nutrition.
Wow, man.
And I think that's really part of the reason why he was able to recover so much faster
Yeah.
than
Well,
everyone else.
I've noticed my recovery's gotten better for sure after adding so many.
What was cool about Justin when he came, when you go to our, any of your listeners go to our website, his testimony, his video testimony is on the front of our website, so you can hear it from him, right? But what was cool about it is when he first came and saw us, I mean, he was at a 7-8, and he talks about in the video, 7-8 pain level. Like he couldn't train, and he fights professionally in Bellator. Like he's the real deal heavyweight. And he came and did his first treatment with us, and he transitioned immediately because he's a professional. He immediately transitioned to plant-based, and within 1 to 2 weeks, his pain level went from a 7-8 to a 2-3. I think 3 weeks later, he was climbing Mount Kilimanjaro. So when he first started with a 7-8, where he can't even train, to 6 weeks later, he's climbing Mount Kilimanjaro, and he's the first one to reach it. It said a lot. It reaffirmed
Well, it's a lot of validation.
Big time.
Right?
Yeah,
A lot of
big time.
validation. So this treatment, the diet, everything. And there's a lot of guys that we see that come in, like I said, they're a little bit older and they've been working out for a while. They've got some injuries from it, or they were fighters and they've got some injuries from it. And honestly, I think the good news is that there are ways through diet and through stem cell treatment or, something like that they can reduce the pain and return the function.
Yeah.
That was there.
And I will say again that multi-layered approach of having not just the prevention, but then also the treatment, and then surgery as a last option.
Yeah.
And then not just the treatment, but then going back and hitting every single one of those points. I mean,
Yeah.
that's such an
It's a
incredible
layered
thing.
approach.
So,
Yeah.
we there's actually a fourth part of what we do with our patients. So we do the stem cells, we do the nutrition, we do the supplementation, but we also do an infrared type of therapy. And so infrared therapy, when it's done, a certain strength, and there's some on the market that aren't hitting the right strength. We really, really focus on finding medical grade type of infrared therapy that when all of our patients, they get this therapy with them, and they take it home. And what it does is when it's put on the area of injury, we put on about 30 minutes a day. And what it does is it reduces inflammation, raises oxygen levels of the blood, nitric oxide, so it's flowing to where the stem cell area is. So there are 4 pillars to the way we do stuff. And it's a game changer. It's different than anything.
Along with the infrared therapy is the specific soft tissue manipulation technique.
That's right.
It's actually been documented that it increases the free-floating your own stem cells by 3 times. And so that's another important thing. Not only doing the rehab to regain flexibility and regain strength, but also doing the proper soft tissue manipulation by the therapist to increase the free-floating stem cells in your body.
I confidently would say there's very few, if anyone, really around this area utilizing this. When we put together with our
They will now after they hear the podcast. Try to attempt it.
Oh, that's a good idea.
Just give us a call.
I still highly doubt that for sure, but it's a unique way. It's definitely unique. It really separates stuff for us.
Gotcha. Cool. Well, guys, this has been awesome. Super informative.
Yeah, thank you for speaking with us.
Of course.
Very informative.
Thank you.
Taking time out of your day.
Yeah, and again, you can find us at Regevity on all social media on Instagram, Facebook, Twitter. So
We'll post all that stuff under the link under the video. And anyway, guys, have a
you,
great
guys.
afternoon.
All right.
Hope you guys
Until
enjoyed
next
it.
time.
Until next
All
time.
right.
Take
Thank
care.
you much.
Bye-bye.
Bye-bye.